Here are some suggestions for improving services for transgender people. Number 1. Welcome transgender people by getting the word out about your services and displaying transgender-positive cues in your office. You can utilize LGBT community centers, services, newspapers, and internet resources to advertise your services. Posters, buttons, stickers, and literature about transgender people can demonstrate that you are transgender-friendly. You can rewrite your intake form to include chosen name in addition to legal name, as well as a third, blank option for sex or gender where someone can more accurately describe their gender. And single-use restrooms are a welcome addition for many, including transgender people. Number 2. Treat transgender individuals as you would want to be treated. You can show respect by being relaxed and courteous, avoiding negative facial reactions, and by speaking to transgender clients as you would any other patient or client. Number 3. Remember to always refer to transgender persons by the name and pronoun that corresponds with their gender identity. Use she for transgender women and for transgender men, even if you are not in the patient's presence. Number 4. If you are unsure about a person's gender identity, or how they wish to be addressed, ask politely for clarification. It can be uncomfortable to be confused about someone's gender. It can also feel awkward to ask someone what their gender is. However, if you let the person know that you are only trying to be respectful, your question will usually be appreciated. For instance, you can ask, "How would you like to be addressed? What name would you like to be called? Which pronoun is appropriate?" In order to facilitate a good provider-patient relationship, it is important not to make assumptions about the identity, beliefs, concerns, or sexual orientation of transgender and gender nonconforming patients. Number 5. Establish an effective policy for addressing discriminatory comments and behavior in your office or organization. Ensure that all staff in your office or organization receives transgender cultural competency training and that there is a system for addressing inappropriate conduct. Number 6. Remember to keep the focus on care rather than indulging in questions out of curiosity. In some healthcare situations, information about biological sex and/or hormone levels is important for assessing risk and/or drug interactions, but in many healthcare situations, gender identity is irrelevant. Asking questions about one's transgender status, if the motivation for the question is only your own curiosity and is unrelated to care, is inappropriate and can quickly create a discriminatory environment. Number 7. Keep in mind that the presence of a transgender person in your treatment room is not always a training opportunity for other healthcare providers. Many transgender people have had providers call in others to observe their bodies and the interactions between a patient and healthcare provider, often out of an impulse to train residents or interns. However, like in other situations where a patient has a rare or unusual finding, asking a patient's permission is a necessary first step before inviting in a colleague or trainee. For transgender patients, in particular, it is often important to maintain control over who sees you unclothed. Therefore, when patients are observed without first asking their permission, it can quickly feel like an invasion of privacy and creates a barrier to respectful, competent health care. Number 8. It is inappropriate to ask transgender patients about their genital status if it is unrelated to their care. A person's genital status, whether one has had surgery or not, does not determine that person's gender for the purposes of social behavior, service provision, or legal status. Number 9. Never disclose a person's transgender status to anyone who does not explicitly need the information for care. Just as you would not needlessly disclose a person's HIV status, a person's gender identity is not an item for gossip. Having it known that one is transgender can result in ridicule and possible violence towards that individual. If disclosure is relevant to care, use discretion and inform the patient whenever possible. Number 10. Become knowledgeable about transgender healthcare issues. Get training, stay up to date on transgender issues, and know where to access resources. Hope these pieces of information will be helpful for you in working with transgender individuals.
Finally, a little request to you. Share this video if this video really helps you to find any solution of your life. All we believe sharing is caring, as well as you can help your friends to change their life by sharing this video. We also believe liking the video doesn't make any difference, but it inspires us to provide better quality and content. We will consider the amount of like as we helped those people at least. Which type or topic video you are willing to see in the next video? Let us know in the comment below. Because helping you is our main intention. The next video will be published next week. Subscribe and get connected with us to get many of these types of videos. More wisdom. More solutions. Better life.